Hey everyone, welcome back to my channel. So it's been 4.5 months-ish since I've had my wisdom teeth extraction. I was not expecting it to last that long. Root canal stuff happened and so I had to kind of wait things out. I think usually it would have taken a month. I thought that I would talk about my experience getting wisdom teeth extraction specifically in South Korea, and for anyone out there who is interested in getting wisdom teeth extraction but may be nervous about it, because yeah, believe me, it was super nerve-wracking for me. So I'm going to be talking about my experience as well as some tips and advice for you if you're going to get your wisdom teeth extracted, which I highly recommend, and not delay it. I will talk more later in the video. But anyway, let's go ahead and get into the video of wisdom teeth extraction. I kept all the notes that they gave me, so if I'm looking down, I'm just reading it. So the beginning of December last year in 2020, I decided to get my annual dental checkup because I actually missed it the year before due to COVID, and I was delaying it, but I just thought, you know, it's not gonna go away anytime soon, so I might as well just do my dental checkup. So I went in December and I just thought that I was just gonna get an annual checkup just to clean my teeth. I had this feeling that I could possibly take out my wisdom teeth because years ago when I was in the States, they said that my wisdom teeth would grow out and I would need to take it out in 3 years or something. 3 years go by and I still have not taken it out yet. I've heard stories where foreigners would just go into any dental place in Korea and get their wisdom teeth extracted for $10, about 10,000 won, which is about $10. And they say it would just be totally okay. Some people say that kind of business is kind of sketchy. Props to them, but for me, I think I can never do that, especially after my experience. 2 years ago, I went to a dental place in Gangnam area and they said, I asked them about my wisdom teeth and they said it's still not fully grown out yet. It's still close to the nerves. So they wanted me to wait it out, and I'm like, okay, I guess so, I'll wait it out. Yeah, they kind of just like pushed it aside, so I'm like, okay, I guess. After that, I went to another dental place for a second opinion and they also said the same thing, so I'm like, okay, so I guess I should just wait for my wisdom teeth to just kind of grow out a bit. Those two places were actually English speaking places, and I'm not saying that English speaking places are not really good in South Korea. Sometimes they are just looking for your money because obviously it's a really good business. If foreigners come to an English speaking place, I've been to plenty, and no matter how fancy it is, no matter how well they speak English, you have to do your research. But anyway, so CK helped me actually to find a place that had really good reviews, especially for wisdom teeth extraction. And I have to say, this place is the best service that I've ever had in South Korea. I'm not promoting them or anything, but honestly, it was like all the staff member. Anyway, I'll go into that later. It's near Seoul National University, aka SNU, which is like the top prestigious school in Korea. So a lot of students get their wisdom teeth extracted there. There's lots of good reviews. So then he thought that we should just go there and get, you know, check my teeth out. At first I was a little bit nervous because I didn't speak Korean that well. Like, I can speak conversational Korean, but this is like medical words that they're going to be talking to me, so I wasn't really sure if I would understand. But he was really helpful and he came with me. I did the annual checkup and I also asked them about my wisdom teeth extraction. And it turned out that I could actually take all 4 wisdom teeth out, but they said, oh, you can actually take it out today. And so I'm like, okay, I'm not mentally prepared for this, but I was kind of on a time crunch too, so I'm like, okay, you know what, let's just take out one side first. I didn't want to take out both sides because I needed to eat somehow, so they highly recommended me to take out my left side because the molar next to my wisdom teeth actually was decaying, and this is like the start of everything, why it took 3 months or 3.5 months to heal. Apparently the wisdom tooth was growing, like it grew too much to the point where it was decaying the molar teeth next to it, so they said that we have to get that teeth pulled out ASAP. So I did get my left side pulled out first, top and bottom. So I was very nervous because I wasn't really understanding what they were saying, and they were just like speaking back and forth to CK, and I'm just there sitting on the chair like, oh my gosh, I'm gonna get my teeth pulled out. I don't know how it's gonna feel like. I think it's gonna hurt, all that stuff. I was super anxious. The dental assistant was really kind and very comforting, I guess. I guess the dental assistants could tell that I was very nervous, so she was very comforting and just like helped me to relax, which I'm super thankful for. But anyway, they started out with anesthesia, and some people say that the anesthesia is more painful than the extraction itself, which now that I think about it, it makes sense. But even the anesthesia didn't really hurt that much. It just kind of has this like tingling feeling, and kind of almost like someone's poking or like pinching you. so it wasn't that painful. So after about 30 minutes or so, they check to see if the feeling, if your lips feels different. From the anesthesia side, they'll ask you if it feels different, and then the dentist will come and they'll have your x-rays already taken, so they know the location and how to do the procedures and whatnot. They started with my upper teeth, and to my surprise, it actually didn't hurt that much. It took less than 5 minutes, to my surprise. Obviously, they do their thing, they do cutting or whatever and drilling. They'll grasp the teeth and then pull it slowly so that the root itself comes out. On the x-rays, they showed me that it's close to my sinuses, so water could go up my nose. But once he pulled it out, he checked my sinuses, and he held by holding my nose and telling me to blow my nose. If I don't know how he checked it, but yeah, I did that, and he was like, okay, your nose is fine. So I'm like, okay, sure, I guess. They did say that if water would go on my nose, they would put something inside to block it. For the bottom teeth, it took more time, about 10 minutes, because it's closer to my nerve. My upper teeth were actually already growing out. They were growing out downward, and my wisdom teeth on the bottom was growing sideways, so that took a little bit more time, and they did some drilling and some cutting. After they extracted both teeth, which I saw, for some reason I didn't think about taking it. Usually people do that, right? I don't know, but I would have threw it out anyway. But anyway, I didn't take it, but I saw it was huge, and I'm just, yeah, it was huge. After that, they put stitches, they put some gauze there, which I had to press firmly to stop the bleeding. So after my surgery, they gave me this gurgle thing right here, and some extra gauze. You have to get your medicine separately, so they did prescribe medicine for me. In Korea, they have lots of pharmacies, so there's one almost on every block. You show them your prescription, and then they'll give your medicine to you, and sometimes it's best to go to the one that's closest to the area, because they're kind of connected somehow. That's how they make money, I guess. I got medicine for about 3 days, which I had to take breakfast, lunch, and dinner. For the gurgle one, it's basically to disinfect your mouth. So I use it after brushing my teeth. It says to use it twice a day, but up to 3 times depending on the situation. I only did it 2 times a day, morning and at night. And you're supposed to gurgle it for 1 minute, and then rinse, and then spit it out. Rinse your mouth with water, and refrain from eating for about 30 minutes. You shouldn't use it more than a week, because it's going to cause some discoloration on your teeth. So I used it for about 5 days, morning and night, and I didn't really gurgle it. I kind of just like swished it in my mouth for a minute, and then for about like the last 5 seconds I would gurgle it. So the gauze that I had in my mouth, I had to replace it every 2 hours. There was definitely lots of bleeding, so I do recommend eating a meal before you get your wisdom teeth extracted. I had to replace my gauze 2 times and waited a total of 6 hours before I could start eating. So definitely eat something before you get your wisdom teeth extracted, because after that you can't eat what you want to anyway. The first time I switched it, a lot of blood came out, and then the second time just a little bit, and then after that just a little bit of blood. And here, let me just read you the paper that they gave me. So they say hold the gauze firmly and spit it out after 2 hours. You can eat after that. That didn't happen. It was after 6 hours for me. But anyway, after removing the gauze, do not spit. It's okay if there's still a little bit of blood, because it's normal. It should be like that for like 1 or 2 days. Don't spit out your saliva or blood. You should swallow it as directed here. Yeah, they said blood can seep out little by little for 2 to 3 days. If you can't stop the bleeding, visit the dental place. And they also gave me an ice pack and recommended to use it for 1 or 2 days. I actually recommend 3 days, and switching it between 3 ice packs, because it will swell a lot. And the first time I only used 2 ice packs, and it melted really fast, so I kind of had to wait for it to freeze up again. But the second time, when I had my right side taken out, I used 3 ice packs, and for a period of 3 days, and it helped with the swelling a lot. The first day there wasn't a lot of swelling. The second day, a lot of swelling. So that's why I recommend 3 ice packs. Also, do not drink, smoke, exercise, or use the sauna for more than 2 weeks. Brush your teeth normally, except for the place where the surgery, obviously. Don't use a straw. Definitely don't use a straw. Keep your meal on the other side of your mouth where the surgery was done, and eat cool food. The next day I had to go for disinfection, and a week later I had to remove the stitching. It didn't hurt as much as I thought it would. It was just uncomfortable because I couldn't eat what I wanted to eat. I had to eat soft food. You just had to be careful around the area when you brush your teeth. So after a week, I had to take out the stitches, and I did go after a week. The only problem was I developed strabismus. What that is jaw lock or lockjaw, and it means what it says. That's when your jaw is locked because you didn't exercise enough, you didn't stretch it. During that week before I got my stitches out, I slept a lot because I just didn't want to deal with it, didn't want to deal with the pain. What I thought was going to be pain, but wasn't that much pain. I could only fit about like the size of one finger into my mouth, about this much, and they're like, no, that's not gonna cut it. You need to at least fit 2 fingers into your mouth to take out the stitches. So they had me go through strabismus treatment. They used this mouth opener thing. I'm not sure what the name is. It has this lock thing where it can open different sizes depending on how big you want it to be. I only went up to level 2, I believe, which is about 2.5 centimeters, just enough to fit 2 or like 3 fingers into my mouth. Very, very small because my jaw was definitely locked. Like the day before, I tried to stretch it and open it, but it would not. And I was like, okay, they'll figure it out somehow. But yeah, that's what happened. I would say that was more painful than the wisdom teeth extraction recovery overall. So definitely try to not get strabismus, which I would tell you how to prevent that later. But he just kind of went and was like, just opened my mouth like burp, burp. Since it has the option, you can't really control like how like little you want your mouth to open. Has this option or this option to open your mouth. It seems like it's a little bit, but at that time with strabismus, it's a lot. So I only went up to level 2 because after that, like, no, I cannot. I felt like my jaw was gonna break. But anyway, after that, they did LED light therapy. They leave the clamp there for a bit, and then they'll bring in the light therapy stuff, which I will show a picture of. But this like helps warm up your muscles or your jaw. They'll do that for 15 minutes, and then after that they'll have these electrical patches too, where they put on your face, parts on your jaw wherever it hurts, and then after that they take x-rays. They didn't think it was going to be this serious, so they said that if it was going to be this serious, I could have came earlier to get LED light therapy. And I'm like, oh, thanks a lot, you should have told me that earlier. After I got my x-rays done, the dentist told me to use a hot pack and just put it on my cheek and massage it to just warm up my jaw. Should have told me earlier, but okay, that's fine. But I mean, in that situation, I didn't know I was gonna get this serious too. After getting my stitches out, I actually had to come back a week later and start my root canal treatment before I take out my right side. So now moving on to root canal treatment. For my research, it usually takes about an hour and a half to do the full root canal treatment, but they said that if I opened my mouth for an hour and a half, it would just be very tiring, and they also have patients too, I'm pretty sure, that they have to get throughout the day. So they divide it into 6 different visits where I would have to come in for the treatment. I had to come in 2 times a week for 3 weeks, and from my memory, I did the first 4 times that I went, they just did drilling my teeth and taking out the decay and whatnot. I think they pretty much took out 80% of my tooth. On the 4th time, they extracted the infection, or like the nerves that are inside the tooth. They disinfected it. And then the 5th time, they did molding and another disinfection. The molding takes about a week to process and everything. So after the 5th time, I waited a week, and then the 6th time they put a crown, which is basically making a fake tooth and putting it on top of your tooth, which would be your new tooth. But anyway, so the nerve treatment took about a month. So they recommended me to rest for a week before I took out my right side wisdom teeth, which definitely did help a lot. Yeah, we still have my right side. Thankfully, I didn't have tooth decay, so I didn't have to go through root canal treatment again. That would have been terrible. But yeah, after I took out my right side, it was pretty much the same procedure and time, 5 minutes, 10 minutes. Pretty much did the same routine, except this time to prevent strabismus, I was not going to go through that again. To prevent it, I slept less, and every hour I stretched my mouth and just made sure that at least 2 fingers could go in my mouth. I ate the medicine, did the disinfecting rinse. Instead of 2 days, I used the ice pack for 3 days, which definitely helped with the swelling. After a week, I had my stitches pulled out, didn't have strabismus, and the dentist told me that I was my condition was way better than the first time, and they said that it would take about 6 months for my mouth to fully heal. I think the biggest problem was food. Like, I couldn't eat what I wanted to. I wanted to eat crunchy foods, but I couldn't. So definitely be prepared to watch a lot of mukbangs. First time I had my wisdom teeth extraction, I was like very diligent. I saw food, made sure to cool down. I did that for a week, I think. Yeah, a week and maybe a week and a half, 2 weeks at the most. But my second time for wisdom teeth extraction, I'm like, I'm done. I'm so done. I lost about 4 kilograms, which is about 8 pounds during that time. I mean, I have it all back now, I think. So even now, I can't really open my mouth as big as I wanted to. I still have to do... I'm still warming it with hot packs and stretching it, which does take a lot of effort and time. Because if I stretch it and go to sleep and then it bounces back to its original size, so it's like a constant thing that I have to keep doing. So that's pretty much my experience. And in terms of the price, the average price for wisdom tooth extraction in Korea is usually like 50 to 80,000 won. This place for one teeth was about 50,000 won. And this place had really good service. Because of my situation, everyone there knew me. I had different dental assistants. They were really nice. When there's like different people, there's like different services. They might, you know, some people have bad days or whatnot. But they were really nice. Just made sure that I was comfortable and they're really understanding, and so I do highly recommend that place. Especially the dentist. Every time I went there, like, I would be very nervous or something, or anxiety or whatever, but he would always smile. Like, although he was wearing a mask, you could tell like he was smiling because you could see his eyes and form things. So it's like, okay, thanks. To conclude my video, I want to talk about some of the main pointers that I talked about in this video that I want to stress to you. Number 1, don't take naps to prevent stitches. And stretch your mouth every hour or so. Make sure that you can fit at least 2 fingers in your mouth so you can take out stitches. After 3 days of using ice pack, start using a hot pack or a warm pack to massage your jaw to open your mouth. And this is really important. Get your wisdom teeth extracted early because it probably will get more expensive as you age and more serious. There was this ajushi who he went in, and I think he looked about in his 40s or something, but apparently he had to take his wisdom teeth out. I don't know why at that age, or why he still had wisdom teeth at that age, but yeah, he had to take it out, and it was gonna cost him 3K. So that was pretty intense. There was also a young student who came in, and he had to get his wisdom teeth extracted that day too. So he was kind of like in my situation at first, like he didn't expect it, but all of a sudden he has to get it taken out. So he was really nervous. After going through wisdom teeth extraction 2 times and also root canal treatment, my advice would be that it's not as bad as it looks or sounds. At first I was really nervous. I could go through it again if I had to, but you know, that's not gonna happen. It doesn't hurt. It's just, like I said, the anesthesia probably hurts more than the extraction itself, and after that you just have to make sure that you take care of yourself. So that's pretty much it for my video. If there's something that I didn't cover and you're curious about, please definitely do leave a comment down below and I will answer it as soon as possible. Thank you so much for watching, and I will see you in my next video.